Hello and welcome to Global Healthcast, brought to you by Global Health Press. Today is Tuesday, October 4th. I'm Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor. Good morning, everyone. Good afternoon or good evening, depending on where you're watching the Global Healthcast from.
This is our 15th edition, and today we exclusively talk about COVID-19 and monkeypox. And I hope you can see my slides now. This is the topic for today. And Melvin, you have the updates on the COVID-19 pandemic. What is the news?
Yes, so like what we do every week, we start with a quick global COVID epidemiology update. And this is from the WHO. And this is not real time, this is a week late. Um, Globally, the number of new weekly cases decreased by 11% as compared to the previous week, with over 3 million new cases reported, and the number of new weekly deaths also decreased by 18% as compared to the previous week, with just over 8,900 deaths reported. And it is still the unvaccinated and the older adults and immunocompromised who have been vaccinated but not boosted who are ending up in the hospitals.
Melvin, this is good news, but let me challenge the validity of the data. Number one, we agree this is not incidence. This is reported cases, and why someone is tested or why someone is reported may change over time. Is there any other explanation why you see this decrease? I mean, it's good news, right? But in the end, is this true, or have we been doing something different before?
Well, what we notice as well in many countries all over the world now, the method of testing and the way they do testing has changed. We don't test as much. I think this is really one thing. And we don't have a harmonized way of testing cases, right? So even if this looks good, like what you said, it doesn't really tell us the whole picture, because the way countries do testing and the way they do reporting is not the same all over the world.
Yeah. One thing in life is 100% sure, and this is death. And
And
I
taxes, paying
like to
tax.
see I like to see that the number of deaths is really down from before. If you look at the high numbers on the left side in here, February, May, June, even, right? And then all of a sudden we have this drop here. Is this due to Omicron? Is Omicron a friend to humans? Do we like Omicron because it causes fewer deaths? Is that the message here?
Well, not necessarily. I would say that maybe that could be one, because Omicron is really spreading fast, but seems to be not killing as much as Delta. But then, so if you look at the November, December 2020 peaks, right, where we have all those, the highest number of deaths, this is the time when vaccination was not yet common for most people, right? We just started vaccination in the UK, in the US, and in Germany, right? In some countries in Europe. And that is the time when the number of deaths all over the world was really the highest. And now if you look at August and September 2022, you see that the number of deaths is really lower than even in this was early 2020.
Yeah.
So this is really, for me, it's vaccination, immunity from COVID itself, and maybe the variants are not as bad.
Yeah, sounds like a good explanation. It's not one thing, it's many, as always in life, right? And
Or
you don't
we,
know.
yeah, we've been better in managing patients now.
Yeah,
So
very good. And you also have good news from monkeypox.
yes, basically this is also showing us some good news as well for monkeypox. The WHO reported a drop in the number of infections compared to the following week. And again, at this time, the data suggests that men who have sex with men make up the majority of cases still in the current outbreak. However, anyone, regardless of sexual orientation or gender identity, who has been in close personal contact with someone who has monkeypox is at risk.
This is interesting. Again, the case numbers going down, and I guess I dare to say you cannot stop sex behavior. Um, I'm wondering, is it more vaccination? Is this more awareness, more use of condoms or other types of protection, or less reporting? It looks like it is slowly going down. It looks like something is working here, but I'm not quite sure what it is. And we always look for explanations, right? We look for a
Mhm.
reason.
Yep.
What do you think? What do you think is the most effective reason why numbers go down?
So one for me really is awareness. A lot of people are aware of how they might possibly be infected with monkeypox, and they know that vaccines are available, especially in at least these countries who are that are in this graph, right? In the U.S., Brazil, Spain, UK, France, Netherlands, they are the countries that have reported the highest number of cases in the past couple of weeks, and they are also the countries where people are now more aware of how to get the vaccine and where to get the vaccine. So I think it's really the awareness, the vaccine, and just talking about the disease and making people aware that these are the risks.
Very interesting and good news. Very happy we talked about that today. Now you have a little bit more on monkeypox, and I'm not sure what to make of it, but maybe you can explain this publication on viral DNA found on skin swabs.
Yes, so this is a new analysis of almost 400 samples from 50 men in France infected with monkeypox, showing that the viral DNA detection via PCR was more frequent from the skin. So that's 88% of men. Also in the throat, you can also find it in the anus, from the semen, and less from blood, less from urine. And I think for me, the high monkeypox viral load from skin and mucosa, including, of course, the genital and anal sites, suggests that transmission most likely occurs through direct body contact rather than through the respiratory route or contact with body fluids, which should help us, the global community, refine the prevention messages that we are delivering to individuals who are most exposed to the virus.
In the end, that means the virus is only shed from an open lesion. And then it is spreading from there to other surfaces by your hands, right? By the person who is infected, touch it is with his or her hands, and then they distribute it to other areas, and you get another lesion if you have a non-intact skin. If your skin is open, basically at some wherever on your body, this is where you can get infected only, right? Normal skin won't give you an intrusion of the virus. Is that correct?
I think we can say that, but again, there will be other publications that we will be discussing in the later slides that would also tell us a different story.
Okay, this is a little bit different from what I thought before, so we have to be careful. Even you may find the DNA of the virus on normal skin, which is important information. And now I think this is more clear now to two linked you in link to monkeypox. There you introduce the virus with a needle, right? I mean, this is a different story. So what do we see on the slide here?
This one is a report on several monkeypox cases linked to a tattoo and piercing studio in Cadiz in Spain. Out of the 54 exposed clients, 20 of them had the disease from, this was in July and August this year. All the piercing and tattoos were performed by one female employee who did not have monkeypox, but she was in close contact with a possible index case on early July. And that person got a piercing while experiencing a rash and a generalized skin inflammation. And in 90% of the cases, patients develop a rash at the piercing or the tattoo site, and subsequent surface sampling showed extensive contamination and unhygienic conditions of the tattoo parlor with detectable monkeypox viral DNA on the tables and the chairs and sharps and other work instruments in the tattoo parlor. I think together these findings suggest that monkeypox virus can be transmitted through exposure to contaminated piercing or tattoo material, and potentially through contaminated hands due to poor aseptic measures and handling of materials.
So wash your hands and use your alcoholic solution. And but again, if you don't have, if you have normal skin, would the virus be able to penetrate normal skin? I mean, that's my big question here.
I think if you have normal intact skin and you are using, you're washing your skin with soap and water or alcohol, I think the answer would be no.
Okay. Very interesting. Actually, with tattoos, this adds now to the long list of infectious diseases due to tattooing, right? I don't want to scare people, but basically it is hepatitis B, hepatitis C, it's HIV certainly, and I guess each bloodborne infection can be transmitted if you are not following hygiene rules when getting your tattoos, right? This adds to the long list of tattoo-linked infections.
Yes, definitely.
Yeah, very interesting. Now, another very nice one, and you have to explain what we see on this slide.
Well, yeah. So the last monkeypox study we are featuring came out of emerging infectious disease, and it describes the infections of two Brazilian nurses 5 days after collecting samples from a monkeypox patient. So the virus was most likely transmitted via contact with contaminated objects. So the nurses visited the patient but had no skin to skin contact with the patient. And they also reported no sharp injuries, no injuries with sharp objects. They were wearing N95 respirators and gloves, but they did not sanitize the clipboards, the specimen collection boxes, and other things that they use to collect samples in the patient's home. And I think this provides evidence supporting the hypothesis that infections observed in the study were transmitted through fomite exposure with surfaces in the patient's home, their own personal protective equipment, or other surfaces of the specimen transport box that they used.
Very interesting. So on the top part, we see the clinical events in the healthcare worker and in the patient. And below, we see that the healthcare worker was visiting the patient's home, and we see the time frame here. So
Yeah.
this is two pieces of information. So the monkeypox virus is not only in the lesion, but after a patient has touched whatever items, they may be on this item. And if your skin is not intact, if there is a wound, you may get infected through that wound. It's rare, however, right? This is a publishable case. If it ever happens, it must be rare, right?
Yes, this is a rare case. We have to say that. Yeah.
Yeah. So this is good news. It's rare, but basically it can happen. And this is why handling patients with monkeypox infection is really, it requires strict hygiene measures, and you should follow these measures very carefully. Very interesting. Melvin, you got another nice publication, and maybe you present first what it means, and then we discuss the new idea behind this, and we will see more of that. But maybe you discuss first. You tell us what's on the slide.
Yes, so this is a visual abstract of the study from the University College London, UCL. Um, a blood a blood test taken at the time of COVID infection could predict who is most likely to develop long COVID. This is what the study is suggesting. It's a small scale study, but researchers from UCL found abnormally high levels of 12 proteins out of the 91 proteins they studied among those infected by SARS-CoV-2, and they found out that the degree of abnormality tracked with the severity of symptoms. So what they're trying to say is that if you look at these 12 proteins, if someone has very high levels of these 12 proteins when they're infected, you can predict who is most likely going to develop long COVID.
Very interesting. Look, in the past, we had one test to diagnose a disease. And this is, for me, the first time that we have not one test to come up with a disease diagnosis, but we have a panel of 90 proteins or more And if certain proteins are positive, if there's a certain pattern, that gives you the diagnosis. So this is new, and this is a diagnosis by artificial intelligence. This is not a doctor or a physician making the diagnosis from taking the history, examining the patient, do some X-ray or some imaging, and then you have a diagnosis. This is artificial intelligence giving us patterns of test results that are linked to the disease. This is very interesting. The other item, this is not pathogenic thinking. This is statistical. So the question is artificial intelligence right or wrong? This is an association, right? The proteins are not linked, to the best of my knowledge, and I did not read the article. Are they linked to the pathogenesis of long COVID? Is there some idea behind what may be the pathogenesis of long COVID, or is this just we test proteins, whatever we have available, and then we found this link?
No, for some of them, yes, but not for all the 12 proteins. But I guess you're right. The artificial intelligence can tell us the pattern, but at the end of the day, we still need the clinical acumen of the doctor or the physician.
Very interesting. I guess more has to be done about that, but we will hear more about that type of diagnosis in the future. And long COVID is not a diagnosis that is easily made on if that test result is there, this is it, right? It is excluding many items, and then you may come up with it. But there's always a degree of uncertainty there because we don't know much about the disease. And uh, I guess we need more data. But this is a first pattern of diagnostics that we will see more about in the future. Yeah.
Yeah, the test would most likely just predict your likelihood of getting long COVID, right? Not
Yes.
necessarily saying that you will have long COVID.
Yeah. It would also identify people who have no long COVID and would just tell them you have a risk for long COVID, right?
Yeah.
So maybe Melvin, we better don't take the test, right?
Yeah, yeah. Not yet.
Yeah. More on COVID prevention. This is another piece of good news, Melvin. What's the message here? What's the data?
So this is from a test negative case control study among healthcare workers in Quebec, in Canada. This was done between March and June this year, when BA.2 was the predominant Omicron subvariant. And if you can see, if you just look at um, the the slide here, you will see that if you had prior BA.1 infection, your protection is 72%. If you had prior BA.1 infection plus 2 doses of mRNA vaccine, it's 96%. If you had prior BA.1 infection and 3 doses of mRNA vaccine, it's also 96%. And I think this shows that hybrid immunity from prior SARS-CoV-2 Omicron infection and at least 2 doses of COVID-19 vaccine provided the highest protection from Omicron infection. Because as you see here, those who received 2 doses of mRNA and had previous BA.1 infection were well protected for a prolonged period of time. And a third vaccine dose seems to confer no improvement to that hybrid protection in this study.
So 2 doses of mRNA vaccine and 1 infection, the protection rate shows us that 2 doses, the third infection or whatever, the third dose would only be an additional booster, which doesn't help you much if you already had your booster, right? If you have the prior BA.1 infection. So this is very interesting. Yeah. It is really very nice. So and actually the mRNA vaccine is the original mRNA vaccine, right? It is not any of the new strains in this mRNA.
No, yeah.
Very interesting. Very good news today on many items. And there is another piece of good news that you show us in this slide.
Yes, on the left, you will see that this is from the Straits Times. Indonesia's Biopharma and the Texas-based Baylor College of Medicine have this important milestone. So the vaccine called Indovac is the first homegrown COVID-19 vaccine approved in Indonesia and can now be used as a primary dose for an unvaccinated or partially vaccinated adult in the world's fourth most populous country. And I think this is really good news for not only for the COVID manufacturer, but for Indonesia itself and for Southeast Asia.
Very interesting. And this is a protein-based vaccine, right?
Yes, this is a recombinant protein-based vaccine.
Very interesting. And how about the right part of your slide? Chinese mRNA COVID vaccine.
So again, in Indonesia, they also announced that they have granted emergency use approval for an mRNA vaccine developed in China, and they are the first. So the one on the right is showing us that Indonesia has granted emergency approval for an mRNA vaccine developed in China, and basically they are the first country to do so. The vaccine developed by Walvax Biotechnology will be produced in Indonesia, and the press release says that the efficacy rate against the Omicron variant is 71%. So China has several mRNA candidates in development, but this Walvax vaccine, also known as AW Corona, is the only candidate in large stage clinical trials and has now been approved in Indonesia.
Very interesting. And look, early on in the pandemic, it was announced that the Pfizer BioNTech mRNA vaccine was also partnered with the Chinese Fosun company. But I never heard that Fosun sold any dose in China. You have any information on that?
Unfortunately, no. What I know is they are still under review by the Chinese FDA.
Yeah. And the vaccine here is probably, again, the, let me say, original virus strain that they are from the original spike mRNA, right? This is
Yes.
not the new variants. Okay.
This is the ancestral strain that
Yeah.
that some people call it. Yeah.
Ancestral. Very good. Also good news. Look, more vaccines coming along. Actually, the last time I checked, I found more than 100 vaccines in phases 1 to 3 for COVID. There are like 30 something licensed or approved vaccines in different ways, and 17 vaccines had been abandoned. So overall, this is very good news. People know how to produce vaccines, and I guess we have now enough vaccines on the market out there so that we can protect everybody who wants to be vaccinated, right? This should not be a problem anymore.
Yeah. So I think the other thing that has to be said about this Indonesia mRNA vaccine is that we are not really sure how this is going to be used in Indonesia, because at the moment, 64% of the population has now been fully vaccinated. That is the 2 doses. And we don't really know how this will be used in real life, in the situation in Indonesia. But I guess the one advantage of this new mRNA vaccine for Indonesia is that it has a longer shelf life and it remains stable at 2 to 8 degrees for at least 6 months, according to the press release.
Very good. A lot of good news today. And I guess to summarize, we showed, Melvin showed you today that the COVID number cases go down, but more importantly, even deaths go down. Monkeypox cases are going down a little bit slow, but they are going down. We told you that the monkeypox DNA can be found on intact skin. We found information on a tattoo-linked outbreak and transmission of the monkeypox virus to contacts by objects. On COVID-19, we told you that a pattern of proteins that test positive can predict long COVID. There may be reduced COVID-19 risk for vaccination after infection, and actually 2 or 3 doses of mRNA vaccine don't matter. Very high protection rates like 96%. And the last information was on COVID, 2 new COVID-19 vaccines in Indonesia. This was really fun today. A lot of new information, Melvin. Thank you very much for sharing with us. And you have your final slide here, and you have to explain this. It is a little
Yes.
bit
So
confusing.
usually when we have the last slide, we put in something funny, right? But I thought for a change, we show something that's a bit meaningful. So I guess this is just telling us that every season has something to teach us. And in the Northern Hemisphere, now we are experiencing a different season, right? And for me, the lessons from autumn are very clear, as mentioned here in this in the photo. Basically, it's just let go of what's weighing you down, appreciate what's fleeting, because summer was just fleeting, right? Just a few months. You only reap what you plant. Change is hard, but it can be beautiful. No rainy day lasts forever. Not everyone will like what you like. Make time to slow down and rest. And it's important to stock up on hope for the dark days that are coming.
That is a very good final word. Thank you very much for sharing. And please write us which topics you would want to be discussed next week. You can download the PDF of our slides today on our show notes from the link below. Please like, share, or leave your comments below. And thanks for listening. I am Joe Schmitt.
And I'm Melvin Sanicas. Thank you very much, everyone. Stay safe.